Hi, I'm Dr. Anuradha, consultant neurologist, Aster CMI Hospital. Today I'm here to talk on Alzheimer's disease, today being the September 21st, the World Alzheimer's Day. The theme for this year is time to act on dementia and time to act on Alzheimer's. So what is the difference between dementia and Alzheimer's? Alzheimer's is a type of dementia. There are many types of dementia. Alzheimer's being the most common type of dementia, we have to celebrate today. What is Alzheimer's disease and why is it called? It is a neurodegenerative disease where the brain cells starts shrinking and patients will have symptoms like recent memory loss, confusion towards familiar and recent things, and certain behavioral changes. As the time progresses, the patient starts deteriorating and they start to even difficulty in recognizing family members. So it has a huge burden on the society because it gives a lot of burden on caregivers as well. So what are the reasons of Alzheimer's disease? Though the main cause of the Alzheimer's disease is unknown, there are many causes which are put forth like genetic, environmental and lifestyle factors. The lifestyle factors being it can be a cardiovascular risk factors like hypertension, diabetes, can be smoking, alcohol and sedentary lifestyle. What are that things which can prevent Alzheimer's disease? As I told you earlier, we can change our lifestyle, preventing hypertension or keeping our blood pressure under control, keeping our blood sugar under control, cessation of smoking and alcohol, and also being very active on a day-to-day basis. So at what age people can get Alzheimer's disease? Alzheimer's disease usually is seen after 60 and most of the dementias are also seen after 60. If anybody is diagnosed with dementia before 60, it is called early onset Alzheimer's. Now let's understand if there is any treatment for Alzheimer's disease. As I earlier told you that Alzheimer's disease is a neurodegenerative disease, it cannot be cured. However, the progression can be delayed with certain medications which are available. But along with the medications, lifestyle changes are very, very important, that we keep the person occupied throughout the day and we give stimulation to the patient on a daily basis. So it's a huge burden on the caregiver. The more important thing is to recognize the disease in an early period, which can help such patients in delaying the progression. The first stage of Alzheimer's disease is called MCI or mild cognitive impairment. So we are actively observing the patient so we can recognize the MCI. And once the patient is diagnosed at MCI, the medications work better and also the progression to the moderate to severe disease can be delayed significantly. Once we recognize that patient has a mild cognitive impairment, you have to visit the nearby neurologist. In the hospital, a detailed evaluation is done for such patients, both for memory, cognition, as well as certain scans can be done to identify the type of dementia and accordingly they can be managed. There are a lot of research which is happening in the field of Alzheimer's, including vaccines, but nothing has been approved till date. So recognizing early, taking a treatment early is the key for treatment of Alzheimer's. Since we don't have treatment for Alzheimer's, early detection is the key. Once you feel that one of your family member is having Alzheimer's or a memory loss, reach out to the nearby neurologist so that they can detect early, help you in gliding through this issue smoothly. Thank you.